I'm guessing some of you will be interested in issues about health and the use of mobile technology in order to promote that. So I'll talk a little bit about that side of the walk. Basically, is walking 1,000 miles good for you or not? I've already pointed out the sandals that I wore. I started off actually walking in boots, and I walked the first couple of 100 miles in boots, up and down mountains, no problem. And then I came to the flat north of Wales, and that's along the coast, a lot of it walking along Prom. And on the second day, one of my feet just swelled up like a balloon. You will do the same movement again and again and again. And then I changed into my sandals and it was a lot better. I noticed I started off, and this is quite critical for understanding the data that follows. I started off not having walked any serious distance since I was 18. And even then, never walking day on day. I might go for a 20-mile walk in a day when I was that age, but only once in a blue moon. Since then, perhaps every year or so, I might have done a walk of 5 or 6 miles, and that's about the longest that I'd walked. So I actually came into it pretty ill prepared physically. I did the last couple of weeks before, I did a few practice week walks, and that was it. The first 3 weeks, I got stronger and stronger. By the time I got to North Wales, I was walking up the mountains and just passing people on my way and thinking, oh my goodness, I'm one of those really annoying people who just make it look so easy. However, it was only about a week or two later when I mentioned the ankle swelling up and basically wear set in. And within a short period, I couldn't bend. My legs, I couldn't bend my knees. My legs wanted to be straight and they wouldn't do anything else. If I wanted to get up and onto a wall to take a photograph, I had to sort of lift my legs up one by one, tootle myself around, turn onto my front and push up. For about a month in the middle, it was just sheer pain. The only thing that kept me going was because I decided to do it. And then it got a bit better towards the end, and something got back into stride. I think my days were a little bit shorter distances. I tend to be a bit front loaded, but it was a very interesting transition. I did wonder partway through whether I was doing permanent damage. However, when I got back, one of the things that worried me a bit was I guessed I would be working on a bit of a calorie deficit, and my legs would be strong, but my upper body would just disappear. And I wondered how bad it was. And it was about a week after I was back at home, and I dropped down onto the floor in the living room and thought, can I do a push-up? And I did 30 push-ups without noticing. Now, for a lot of people, that wouldn't be much. But for me, before that, if I tried to do push-ups, I could do 10. But if I was lucky, I would stretch to 20, but probably somewhere between 10 and 15. And I did 30 push-ups without even noticing. And then after the next few days, I realised I could do 50 push-ups regularly and sometimes more. And as in the picture you can see there, I could even do 30 with my feet on a chair. Now, I'm not showing off. Well, I'm showing off a bit. The amazing thing is my arms. I was doing nothing with arms. But of course, push-ups aren't about strength. They're about cardiovascular fitness and also core muscles that hold your body straight. And those are both served very, very well by the walking. My whole cardiovascular system has changed. Now, presumably I need to do some work to keep it like that, but I haven't actually been doing a lot, and I've noticed continually. Now, this is known. Walking is good for you. The Macmillan. While I was in the walk, I met the CEO of Macmillan, who is a cancer care and research charity, and he said that actually the single most effective, it's not palliative, but cure, as in things that make you better or help you get better from cancer, is walking. It actually beats every drug. It doesn't mean the drugs aren't useful as well. It adds to them. But in terms of a single effect, it's the strongest. Recent research put it at something like 40%, the improvement of presumably 5-year, I'm not quite sure the period, survival rates. Absolutely incredible effects from walking. And yes, actually, while I was walking, I happened to also pass a Race for Life, which is a cancer charity collecting run when I was up in Carnarvon. Crucially though, and I think this is an important thing, is it's not so much about the data, this is more about the politics of health. Also talking to a number of people on the way, a taxi driver who was somewhat overweight but would like to do more exercise, somebody else who had been trying to encourage exercise in Swansea. Walking seems like an easy thing. We all walk. But to actually walk for exercise as opposed to just walk to the shops, you can get by, but having good waterproofs, having good shoes, all of these things matter. It actually costs money to keep healthy. And it's a major challenge in society. People don't do what seems to be an easy thing because they can't afford the kit. Now, actually, probably they don't need it, but the whole of our society says if you want to do sport, you need to have your latest Nike, Adidas, whatever it is, in order to do it. You're priced out of health if you're poor. I said, doesn't affect the data, but absolutely a crucial societal issue.